computer. All right. Well, I think this is pretty much it, but hopefully somebody else they can log on anytime they need to. But I wanted to introduce Julie Yerkes. For those of you who don't know me, I'm Jen Thomas. I'm sorry, with C3PH. Emily is also with C3PH. And Julie Yerkes and Tanisha will be doing the SAP informational for you today. They have a few slides to do some general info and what everything looks like, and there'll be plenty of time for questions and answers. So, Julie, I will turn it over to you, and I'll watch the waiting room.
Okay, great. Thank you. Hi, everyone. I'm Julie Yerkes, and I work at JSI Research and Training, and we hold a contract with the Bureau of Drug and Alcohol Services to be the facilitating organization for the New Hampshire student assistance programs that are funded by the state of New Hampshire through the Bureau of Drug and Alcohol Services. And so we are in our third year of that, which has been really fun. And my colleague here, Tanisha, you want to say hi?
Yeah, hello everyone. My name is Tanisha. I'm a program coordinator at JSI working with Julie on this project. It's really nice to be here.
Thank you. And I'd love if I could, I know, if small group, maybe we could just go around and say hi and what school you're from and what your position is, and that'd be helpful for me. I don't know. Brianna, do you want to start? Oh yeah, because you're the one that's eating. So I asked you
Sorry,
to
it's
start.
totally fine.
Sorry. Yep. That's
My
I
name's
used to
Brianna.
waitress. I'm really good at it.
Yep. I am the family liaison for Paul School in Wakefield.
I don't know who's next, but I'll go. I'm Lori Dennis. I'm one of the school counselors at Kingswood Regional Middle School.
And I'm Dennis Pelletier. I'm the other counselor at Kingswood Regional Middle School.
Is my volume up? I'm on my phone, so I'm not sure. So this is Mary. I'm Mary Schiller. I'm on the school board at Governor Wentworth Regional School District. I'm also a member of CERT and C3PH.
Thank you. Hey, Chuck, we're just introducing ourselves. Do you mind saying
Sure.
hi?
Hi, I'm Chuck Henderson. I work for Senator Sheen in the North Country of New Hampshire.
Awesome. Great. Nice to meet you. And Emily, I haven't met you before.
Hello, I'm Emily McCardle, and I'm with Carroll County Public Health too. I help with the young adult outreach and all sorts of things.
Awesome. Great. Thank you. Thanks, everyone. So I have a few slides that I can kind of help me go through this a little bit. And, I guess maybe even before I start, if anyone has any, like why you're here, why you're on, like what you're interested in knowing, that'll help me focus my time. Unless you just do whatever Jen asks, which is totally legit, like to go to anything. So she asks you.
Is now a good time to share that?
Yeah, I'd love it.
So thank you. This is Mary. I guess my ultimate background, I'm a retired elementary school teacher, sociology background. So the health and well-being of children and families and the support of teachers is huge. And I've gotten involved in those various things in my retirement. To that end, we just completed with the Governor Wentworth Regional School District the strategic plan, of which there are 4 facets, achievement, of course, being one, but student wellness and well-being. And to that end, obviously, social, emotional, all those aspects. But most recently, I'm hitting hard this universal meals as part and parcel to well-being. So we're pushing that hard too. To me, it's Maslow, it's all those things. And I really appreciate seeing the counselors here and some familiar faces from C3PH. So I guess that's kind of it. No one thing, is it? The whole child.
Great to know. Thanks, Mary. Anyone else want to share why they hopped on? Brianna?
A few reasons. We were lucky enough to have Jen and Emily come for one of our open houses this year. And they shared some information about the student assistance program and mentioned how so little schools in our area have one. So just learning more about that. I think being in a rural area, there's a shortage of providers. So any, out of the box ways that we can further support our students, is really important. And we're also really focused on student wellness this year. Were a recipient of the Promising Futures grant, and we're focusing really heavy on being able to get an evidence-based substance prevention curriculum in place, and just focusing on other forms of student wellness as well. So I think I'll get some good information from this to bring back to the team.
Excellent. Yeah.
I think I just want to, reiterate something that Brianna said, that when Lori and I were discussing the possibility of signing up for this training, we were just looking for other tools to put in our toolbox. Being the largest geographical district in the state, our population is pretty diverse. And we just think that the more tools that we have to be able to offer our students and families, the better equipped that we're going to be able to help make a difference and to be able to support people.
Awesome. Great.
I'd like to kind of kick in why I was got so interested in moving this forward too. The more prevention we have and the more supports we have, and like you said, Dennis, like the more out of the box thinking, to help with providers, SAPs in the school, or like having behavioral health and prevention like sort of combined, and it's just an added layer of prevention, any kind of prevention, I suppose, for mental health, for substances. And so it's good to see that. And it'd be really good to just add more supports for the kids. That's why I was looking more deeply into it.
Great. And I don't know, Chuck, if you want to pipe in, you're not out of school, but just curious what brought you here.
Yeah, I'm a generalist, so I cover all issues. So yesterday I was working with the railroad to get some track repaired and get a federal grant to help with that. So, and then forestry, spruce budworm is getting ready to make a big outbreak. So, but students are, obviously critical to our future, and there are, sort of a lot of mental health issues throughout society. So I see the whole picture. I'm a jack of all trades, a master of none, but I have a diverse portfolio of issues that I'm interested in.
Great. Wonderful. Well, thank you. So I'm excited to share this. I had actually approached Jen as a partner on trying to write another grant a couple of months ago, because Carroll County has in the state, higher levels of mental health and substance use on a number of indices, and according to the YRBS than other, the rest of the state. So, there's definitely some need in the county, and we know from the Student Assistance Network that there isn't one student assistance program coordinator in any of the schools in the whole county. It's the only county without one. We used to work in Kennett. We had one, and that SAP coordinator moved on, and they have not been able to find a replacement. And so, Brianna, when you were saying that providers are, they're rare and hard to come by, we understand that that's a huge challenge, and we're working with the Bureau on this. Fact is that we can fund schools to hire an SAP coordinator, but if there isn't one, what do we do, right? So thinking out of the box and being creative is exactly what we'd like to do. So just to level set a little bit about student assistance program. I know we've had SAP, SAP, student assistance in the state since the drug and safe and drug-free school grants in the 80s. And then funding has gone like this, and so it's been like this, and some schools have funded their own. And so the SAP model in New Hampshire varies from school to school, depending. What I'm going to be speaking to right now is what the Bureau of Drug and Alcohol Services funds through their funding stream, which is an evidence-based program, and is very much prevention focused. And I'll go through all the parts of it in a moment. But what's really interesting, the SAP was really modeled after the employee assistance program. So this idea that providing opportunities, knowledge, resources to all students, right? To have that primary prevention, kind of like if we have an employee assistance program, you may have access to trainings and resources to improve your health. And then, so it provides that primary prevention to all students, those universal strategies to all students. That can look like newsletters out to families about emerging issues. That can look like bulletin boards and school-based activities that increases knowledge, skills, and attitudes around mental health, substance use, and just healthy behavior in general. It provides early intervention to students who are exhibiting risk factors that are interfering with their educational success. So, that really looks at high absenteeism, change in behavior, mood, academic, a kid starts falling asleep in class and was never used to do that, is showing up late, is, looking disheveled, not their hygiene isn't as good, any of those like very physically obvious, apparent things to, things that they're sharing outwardly, right? And we have some ways to assess and screen for that, and we'll talk more about that as well. And so really providing that intervention, working with that young person to kind of figure out what they're needing in order to be, of course, healthier, right? Better, get the resources that they need. And what's important for teachers to know is so that they can be more, and principals is that to be more successful academically, right? So that there's a win in it there. That's what the employee assistance program was, right? Not really necessarily the good of your heart, because you want to take it so the employees can be productive, right? So sometimes we hear that as a concern. Why are kids leaving class to go talk to the SAP? Well, it's like what Mary was saying, we realized that kids needed to have a full stomach in order to be successful in school for the day, right? You got to have be emotionally regulated enough to be able to be in class. And then, of course, if that tier 3, right, those higher, the students who are experiencing they're not just showing risk factors for mental health challenges or substance use, but they are actively engaging in or experiencing mental health challenges. And so connecting those students with the appropriate level of resources. So that's the framework. It looks very much, Brianna, you mentioned Promising Futures grant, right, with MTSSB. It's the tier 1, tier 2, tier 3 model of universal, help me out, Jen, universal selective and indicated prevention. So different terms depending what, hat you're wearing. So what are some of those barriers to learning that might be observed that might be referred to a student assistance program coordinator? And I'm sure, you guys see them too, Lori, and I think it's Dan. I changed my page, my note page. Dennis, as school counselors, right? You might see these kids too. Any adjustment difficulties? You've got a new student who's moved into the district in the middle of the year. How are they getting adjusted to school? We know that transition is a big risk factor for developing a substance use disorder and participating in high risk behaviors. Attendance issues. Why is this a prevention issue? Of course, attendance impacts academics, right? And connection to school. Being connected to your school community and feeling safe and seen and connected to school is a protective factor for substance use disorder, right? So that, and so many other things. But why does the Bureau of Drug and Alcohol Services fund this program that works on this stuff, right? Because we do know it's a risk factor for substance use disorder, as well as other behavioral health challenges. Anxiety and depression, again, risk factors for substance use, thoughts of self-harm and self-injury, stress, abuse, and neglect, other substance use related issues, vaping in the bathroom, bringing the bottle to the basketball game, pre-gaming before the school dance, the things that happen sometimes. Family difficulties, negative peer relationships, that stuff that's going on in the hall, the fights in the morning, the bullying, the texting, the relationship issues, all of those that we're seeing such an increase of in the data, as well as anecdotally from all of our counselors. And then, of course, exposure to violent and crime in the community. So I think somebody said you were on the CERT team, which I don't know if is that the crisis response team for you guys?
Yes.
Is CERT, yeah.
Yep.
So that connection of, okay, something happens, this kid has been experienced trauma. How are they being supported for those 8 hours while they're at school? So those are some of those barriers to learning that the SAP would be heavily connected to and support for. And we went over this a little bit, but what does a student assistance program coordinator do? And not really one person, typically really part of that student support team or the MTSSB team, if you have MTSSB at your school. So we really see SAP as a program, and the coordinator helps coordinate all these things at the school. So the universal prevention strategies, there are different prevention themes throughout the year that student assistance coordinators would promote, usually in conjunction with the SMP, the Substance Misuse Prevention Coordinator at the public health level. So, working with Jen to bring together resources and to increase knowledge, skill, and understanding and change attitudes around one of the big goals of that is to respond to the decrease in perception of harm that we have noticed in recent years around cannabis use. So that is like one data-driven strategy that an SAP might be working on, is to increasing knowledge and with families too, right? We see that a lot, that often is coming. Parents need to be educated that, hey, it may be right for you, but that doesn't mean it's right for an adolescent brain and development. Direct education, they'll go into classrooms, often in conjunction with the health teacher or a guidance counselor. If the guidance counselors do like a series of education for all of ninth graders, for example, they'll go in and we call it the prevention education series. And that's really to be decided upon with the school team. How much time do you have? What are the issues you're really looking to address? But it's an evidence-based, it needs to be an evidence-based curriculum. Project Success has an evidence-based curriculum. What are some other ones?
Botfin.
Life skills. What's the other one that you do in the North Country a lot? Crime for Life is another one. Some schools are working with their police department and doing lead. So there are a number, and we provide support to figure out what's the best fit for your school. So those are the real universal strategies that are used. And then there's that early identification. So they receive referrals. Teachers can refer, students can self-refer, parents can refer, a community-based partner who may be working with that student in a different capacity that learns something and realizes that kid needs additional support while they're at school. They could refer. And then in those early sessions, the SAP coordinator would do some screening and assessment to figure out, what are the needs of the student. And then connecting them to those evidence-based interventions. And so it really could be a few skill building sessions with the SAP coordinator themselves. They might have 6 kids that are working on the same skills, and they start doing groups. They might have students who, a group, one of the groups that they do are newcomer groups, for those students who are new to the district at the beginning of the year, to introduce them to the school and start building some skills around getting engaged. Another one might be children of substance using adults, because that's a high risk factor for that individual to develop a substance use disorder later in life. So that's an example of some group. One thing I want to really mention here and make sure is clear, like what a student assistance program coordinator does not do. They do not do therapy. They do not do treatment, right? So they would see somebody that is referred to them, and they would work on identifying what their needs are and then get them to the appropriate level of care, which is that referral process. It may be a referral to a school-based support. It may come out that why are they acting out? It could be, okay, we need to actually do a learning assessment here. They finally have opened up about what's going on and their frustrations in classes, and it's really sounds like it's more learning. Or it could be they're tired in the morning because, they've been up all night with their younger sibling because their parent works, second or third shift, and they're the primary caretaker at home, and they need support. So it depends, what they need, and the SAP coordinator is there to really coordinate that. And then that guided support for students. Some students, let's say they get referred and all stars aligned, and they get they get to be connected with the treatment that they need. But then they're in school, right? So you may get to go see your therapist to work on issue X once a week, but you may be in school and something happens, and a safe place for this student to be able to go to get support, not treatment, but to get support to support the treatment that they're receiving outside the school. I had an SAP request some funding a couple months ago because a student came to her office pretty shaken up. And she hadn't really met with the student before. They weren't super close, but she was really exhibiting some distress. And she shared that she self-harms and that she's getting, she had a therapist, she was working with somebody about it. But in her new chemistry class, there were cracks in all the vials. And just seeing the cracked glass triggered her and made her, So, the SAP was like, can I have $9 to buy a new set of vials? files and not have to tell the like, I don't have to disclose anything. Can I just get some new Yes. Yes, you can, right? Like, so that's that sort of like school-paced support for outside treatment that can happen and can go a long way. But again, they are not providing treatment in the school. So any questions so far that while I've kind of described what we're talking about when we talk about SAP? Does that align with what you were thinking and what you know of the program and like what you're, yeah, okay. Yeah, Jen.
Just a quick question that you said they can kind of coordinate access to these services, or are you finding that the SAP coordinators are needing to use like a virtual option for any kind of connections to anything?
I think it's a mix. Yep, I think it's a mix, and I think there's support for that. While the framework of the program, the network's job, we're really tasked with aligning the state-funded, programs and in terms of approach and strategy and evidence-based requirements. We work with every school and every counselor where the school's at in terms of what their school policies are. So some schools do have the space and the policy to allow students to access care virtually while still at school. Others, that is not on the table, right? You're not. They don't have the space. They don't have the privacy, nor comfortable having the student come out of class to do that. So you've got kind of the whole range. And then in terms of not even school-based, just making those connections, I do think, and I have no data on this, but I do think that SAP coordinators are having success with virtual telehealth and the increase and I would imagine that would be a really, I know it's very helpful in the North Country. I'm sure in Carroll County it would be very helpful to know that those resources have increased.
Well, yeah, mostly because I have tried like 36 behavioral health providers. None of them either take kids or Medicaid, or they have a waiting list and they're not taking any people. So they're, as of currently right now, unless people can pay full price for a behavioral health specialist and wait 8 months, there is no care for youth under age 18 in Carroll County. So that's I'm trying to other ideas.
Yep. And I think, one of the things, and I know that we're at a place where we're still responding, right, to healthcare, to mental health crises and mental health illness, right, mental illness. And I think with SAP, they're a wonderful resource to helping respond to that and helping connect and coordinate care. And also, we need to make sure they're not so taxed that they're not doing any of the prevention that is part of this, because ideally, in an ideal world, we're preventing the crises. We're preventing the need to actually get to the place where you need treatment, because we're doing these lower, we're having these individual sessions, we're building those skills, we're doing the group work, we're really working on that prevention piece, because adolescence is fraught with challenges, right? And has been throughout time. It is a hard time, and trauma is, scarring when it's not processed. But when it's processed, it's, you build resilience. So when we have the opportunity to see and support young people early in this journey through a really hard time, the hope is that we're getting them through that without hitting crisis and needing treatment. Right? We're not there right now. I mean, there are not enough people on the ground, to be able, to both treat and prevent things. But that's the goal. So what is the network and why am I here today? So the Bureau of Drug and Alcohol Services supports this facilitating organization through a contract, and we are here to fund and support SAPs. So we are charged with developing and aligning student assistance programs in the state of New Hampshire. And aligning is a big piece because, when somebody knows that it's a New Hampshire, state-funded SAP, they know what they're getting, right? They know what it is. How do we do that? We provide group and technical assistance. So there are, and I'll go through all the supports we do, but we provide a lot of assistance. And then we support evaluation and sustainability planning as well. So these are the people that work on it. We currently have 44 schools that are funded. There are 20 middle schools, 5 middle high schools, 18 high schools, and 1 community college. And they are all around the state, except for right there. That's you, right? So here are the ones in the capital region. I'm going to go through these. This was, but they're all over. So yes, Jen.
Oh, you might get to it later, but while I'm thinking of it, how long is the funding for in case people don't?
Yeah, great question. It is, it's state funding. So we get funded a year at a time. Actually, this year we're on a 2-year funding cycle. So we actually know we have a contract for state fiscal year 26, which is like amazing. And they are very aware of the fact that this is a huge barrier to this work. And the Bureau has been working hard to change, they have made improvements in the last year and a half on the funding cycles. So I'm hopeful that we're really trying to get them to push it up so that we know it before school ends. Because really, right, a lot of times state contracts, you don't know if you have a contract till after July 1st, and then the school is sitting there like, now I'm supposed to hire somebody at the end of August, it's not fair, so we have a lot of conversations about that and how we can ensure that we know what our funding is far enough in advance to let schools know what they have. But it is, it's a year-to-year thing.
And did you mention it's in line with a teacher's salary? Is that what they're looking for?
That's a great question. That is really up to the school. The network's recommendation is that if they want the same person to be there more than a year, you're hiring a professional and they should be treated like a professional. And that is the network's advice, is that their pay be commensurate with other professionals in the district. Brianna, did you have a question?
That was basically the same question I had, was just if they would be a district employee and how that would look.
Yeah, it's really up to the school. So we have some schools, they are on a teacher contract. We have other schools that contract with a community-based organization, and that community-based organization does the hiring. Basically the school gets the funding from us and then sends it to the community-based organization to pay for the staff member. Others are on a contract as a contracted employee from the school. It really depends on what the school, what their setup is and what they want. And we can provide some guidance around all that when it's time to figure that out, some pros and cons. But we do know that turnover historically has been much higher for folks who are paid below the average, the district rate, and who don't receive health, who don't receive benefits. We're hiring professionals, they have families, they need to pay rent, all the things. So when a school contracts with the Bureau, with the network, a big piece of our contract with the Bureau is fidelity, making sure that SAP is being implemented, because it is an evidence-based program that we follow. So doing the components is important. And what those are is, and we've really gone over most of them already, but to that point that I was just talking about, that it's a professional, that they have a direct person at the school who would be their school contact. And then the network provides a lot of supervision, that they would be doing outreach and integration into the school community. They do that prevention education and consultation with staff and parents. They are allowed to do those universal strategies, screening and assessment, individual support or referral, group support, and then evaluation sustainability. So those are all those pieces I kind of went through already. This is some of the support. Oh, actually, this is more of the contract. So we also ask, and this is in the contract because we did find when we were originally trying to provide technical assistance to the SAPs that we'd be like, oh, we're doing this meeting, right? We're having a training for you. And they're like, I can't, my principal won't let me go. And we're like, well, you need to come to these. So coming to these meetings is a contract requirement. And then we will do site visits and come to the schools, the new schools, to just check in and get to know everyone and answer any questions. And we can do this whenever it's requested. And then we do ask that the school building administrator and or district administrator attend 2 meetings a year, just to make sure that we're all on the same page. And then we need to participate in the state's reporting. This is all aggregate and de-identified. There's no personal information going in. It is basically saying, how many students did you meet with this month? What were some of the issues that you saw? There's nothing in this reporting that identifies any student information. So those are the contract requirements. Do the program, report on it, and get support. Like, we're requiring that people get training and support. And what does that support look like? We have these regional peer collaboratives. So there are 5 different regions in the state, and folks will go together to meet. And this one is actually optional. You don't have to go to this one, but folks really like it. We have drop-in hours that they can just call and say, hey, I have this issue. I don't know, how to approach this student, or, a parent called, I just need some support. Because SAPs find themselves in a very unique role in a school. They do have different role than and different ethical guidelines than a school counselor or a teacher or an administrator. So there's kind of a little bit of an island. And so the network tries to provide a bit more support to answer these things, that, we don't want the school to be having to answer stuff that they're like, this is a little out of our normal knowledge. We have group mentoring. So a bunch of new first year SAPs come together to learn together. We have one-on-one mentoring. We send out a monthly newsletter that has a lot of those universal strategies highlighted, resources, so that if they want to send out a newsletter to the parents about vaping, they've got the information. It's all science, and it's all written, ready to go for them. If they want to do a bulletin board to increase, knowledge around, I don't know, Alcohol Awareness Month, we provide that for them. So that they can spend more time with students, and still be able to have this impact. We have in the contracting and the budgeting, we support professional development. So if the school would like to request funding so that they can send their student support team to a conference, or get more professional development for their whole student support team, that could be possible. We also have some funding at Nhatica that folks can use to get the trainings there. Jen?
I can also help find the free trainings as well, because I'm pretty good at sniffing out some free trainings as well that are approved by the ICNRC board.
Yeah, awesome. Great. We have a whole database online for all the materials that they need. So I share all that with you because one of the concerns that we hear from new schools is, okay, well, we're going to get this new role at the school. How do we support them? We don't know how to, it's okay. We'll support them and we'll support you, right? So we are happy to meet with, school support, like the head of the wellness department, as often as possible, are necessary to support the role, and help navigate a new staff member kind of coming in. Well, all right, well, we have a social worker and we've got a school counselor, and now we have an SAP. What does that look like? Who goes where? So we've seen pretty much every configuration of student support, and I'm really happy to be thought partners and sounding boards. And there's no exactly right map of that. Before I talk about what's next, any questions about the network and the supports and what we can provide for schools who are interested in student assistance?
Well, I wanted to sort of, Brianna, good to see you. We'll send you all the information and everything too, okay?
Oh, you have to leave. Okay, bye.
Thank you. I appreciate the information.
Thank
Yeah.
you, Brianna. If you have any
The next
questions,
part's the most important.
yeah, can you speak a little bit more about how you can sort of work with each school to sort of, I guess, sort of tailor the program, or at least examples or two?
Yeah, we come to the school and we'll sit at like a planning meeting for a couple of hours, and be as active or passive as the school would like or need. It doesn't usually happen in one meeting. It can happen over time. Like I mentioned, those site visits will, we check in all the time. It's really, we're especially new programs, we check in all the time, and we can come and we can get on Zoom whenever. It's really, sometimes it's about trying to really help with referral, like what would a referral look like, and how do we distribute students, right? How do we get students to the right level of care, and who should see them first, and da 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 da. So really happy to be a thought partner on that. That's what we've done most of the time. We don't have a set like, okay, if you have two social workers, a school psychologist, like if you have all these people, this is what it looks. We don't do that, because schools know what works best for their communities. So you contact me if anyone has more questions, or is interested in supporting looking into getting an SAP, contact me. We would start with a meeting with the school the school team, whoever's interested, whoever wants to, if you just want to learn more, for your school, and not ready to bring anyone else on yet, because you need to build capacity before you even bring others on to a meeting, that's fine. We have a readiness checklist, kind of do you have these things? What do you have? Do you have a spot for them? Do you, and then you would apply for funding, and then you would work with us. If granted the funding, you would work with us to hire and onboard the coordinator. So it's kind of looks like that. And I can share the application. I can share the readiness screener, so that you could just see what that would look like. Some other opportunities, Brianna mentioned the Promising Futures Grant, and I think they have a new cohort starting, will be coming up in the spring, maybe. And that, do you guys know what the Promising Futures Grant is through then? So that's through the Office of Social Emotional Wellness, and they have some funding from the Bureau of Drug and Alcohol Services. And what they're doing is some grant funding to explore MTSSB, the multi-tiered system of support behavioral. And then the Bureau's piece comes in to, she said she was looking at an evidence-based substance use prevention strategy. So the Bureau's okay, as you're looking at this multi-tiered support for students, that universal piece where all students get some substance use prevention. So they've provided funding to spearhead that. We have one school just now that applied for SAP funding using their Promising Futures grant as half, and then the SAP is going to be their evidence-based substance use prevention strategy, which is a really resourceful to kind of do that. And then another opportunity is there's some funding through the network to spend time exploring applying. So very similar to this Promising Futures, but getting your student support team together, looking at the readiness survey, and the grant could provide stipends for meetings after school. It could provide food and, stuff like that to make your time when you're working together on a new project more enjoyable. So that's an opportunity too. If a school isn't ready to jump 2 feet in to apply right away to have an SAP, they might want to spend a couple of months over the spring exploring it and going to trainings, learning more. So that could be an opportunity. And the other one that I want to mention, that this is such a cool connection, have Building Futures Together through UNH's Institute on Disability. Have you heard of this program? Anyone? It is so cool. It is an opportunity for paraprofessionals to take and get certified to be behavioral health workers, to work in the behavioral health field. And what I love about this is in rural areas in particular, what I have heard and what has been my experience as growing up in the Northeast Kingdom in Vermont is that there are folks who live in your community who love your community, and they're there. And sometimes there are not job opportunities, but the school needs, staff, to do things that support young people. But there's not I don't know, a pathway to build skills and professional knowledge. So that's what this does, is it not only provides the training for free, there's a pretty significant stipend for the person who participates in it. So it's a really great way to build your local workforce. So that is when we're asking ourselves, okay, but we can't even, we can't hire a math teacher. We can't hire right? We're understaffed in all of our academic parts. We're understaffed in all of our other things. But you probably you may or may not have that parent who's like, I'll do anything you want, how do they get the education and training to be able to serve a role that would be really, really wonderful for the school. So that's what I have for you guys. I hope that answered some questions, but I'm also really happy to have a conversation, hear what your concerns are, any questions you have.
I would love to hear what people foresee as some barriers with other, within their schools.
Probably going to fall on you, Lori and Dennis. You're our only school rep here right now. What do you think? I'd love to hear.
Well, I think initially the biggest barrier is probably a common one, but I'm not sure, is paying for, like you was mentioned, paying for another position. So, public schools have a great deal of needs in many different areas. So I think that there are teachers that are advocating to administrators and to school boards for what they think is an important need. Then you have counselors advocating and talking to principals and sometimes school boards for what they think is an important need. So our building's full of need. And so, having to, it's tough to prioritize those needs and pick one or two to advocate for, when cost of salaries and insurance and schools are struggling with filling paraprofessional positions, teaching positions, janitorial positions. So I think, just for the sake of transparency, I think I missed in the fine print, or when I signed up for this, I thought that the SAP was a service being provided, and that we would be able to call on the expertise of an SAP to come in when all else has failed.
Yeah.
But going through the presentation, I was saying to Lori on a few occasions, it's amazing how much of this stuff we already do as school counselors. And Lori, who has experience at one of the schools that had an SAP, her response to me was, well, yeah, it was nice to just be able to refer some students to the SAP so that I could focus on other things. So there's definitely a need in, I can see a lot of benefits. I was excited about the SAP thing until I heard we have to hire an SAP, and I was like, how's that going to happen?
Right, but we
there are
fund it.
resources. So I'm right. So there's the grant, there are resources out there. But I don't know.
Yeah.
We
Yeah.
also have a huge need, when I think about student family needs, right? At the beginning, when I said, what I was hoping to get out of it was, I included the family component, is some sort of social worker that can actually go into homes and work with families. I think that a lot of the issues that we're facing, and I think schools in general, we have a lot of students that are socially maladjusted, meaning that they just don't have the skills or the tools to be successful in a social situation, which is public school. And so, we take on the role of trying to teach those things a little bit, during the day or once a week when we meet with the student for maybe half an hour. And then
Yep.
we try to give the teacher some SEL skills that they can
Yep.
incorporate in the classroom to teach these kids skills. But we don't have anybody kind of tackling the problem where a lot of time the problem exists, and that's in homes when
Yep.
kids should be learning these skills from the environment that they're coming from. And then public schools are just overwhelmed throughout the country with trying to manage these behaviors in schools by hiring another person and and having them like coordinate care. And it's like I so
Yeah.
so I need to all let it kind of rest, sit with
Of
me
course. Yeah.
and give it some thought.
Yeah.
Because I'm reluctant with anything that I do to just jump forward and say, oh, this will be great, because
Yep.
resources are so slim.
Yeah, absolutely. And I thank you for all of that. And that is definitely, I think, such a big piece. Well, first, I think a huge piece of SAP is doing exactly what you're talking about, but having more time and focus to do it. So really noticing those kids and doing some group work with them, and getting them in group to do that skill building because it's so impactful and so effective. And there's just so many gains and benefits from them learning those skills in group. And a lot of times what happens is that you learn that a lot of that maladjustment is coming from, often parental substance use or other mental health challenges at home. And so, the SAP will works so hard to get the parents involved. And if they can't get involved, they'll still be doing this support there, which I'm sure sounds like you're doing as well. But it is another set of hands. And then once you figure out if, there are some very substance use specific things going on, that you're also working on those risk factors as well. In terms of, yes, another job for the school to do, I totally agree. So the funding, is that's what this does, is it funds the position. And it is exhausting to do a hire and a search and a train, right? Train a position. And so the network could support a school along that whole way. We have job descriptions ready for the posting. We have, suggested compensation, levels. We have a whole manual of implementation. And then also there are a number, like I mentioned, of regional community-based provider organizations that can do the hiring as well, and take that piece on, and you would subcontract, the school could contract with them. Ones that are doing that right now. And geography doesn't really matter. It's not really, it doesn't have to be the local one, the most local one, but we have Second Start in Concord, Second Growth in the Upper Valley, Seacoast Youth Services, Adapt in, where's Sean O'Brien? Adapt in Campton, and one more, Monadnock Family Services in Keene. So most of them are pretty far away, but again, where they get hired out of and who takes care of that back end stuff doesn't quite matter. So that could be an option too. Any other thoughts?
Thank you.
You're welcome.
Awesome. All right. Oh, look at that, right at 1 o'clock. Excellent timing, Julie. But
Great.
well,
I'll send these slides out. I'll follow up with Jen and just send the slides to her, and you can take a look at them. With that, I'll share a couple other links as well, like so you could learn a little bit more about the network and the application process. But really just happy to chat and be a resource with you as you think about adding support to the school, and your student support team.
All right. Well, I'll
All
send
right.
everything out to everybody as soon as,
Thank you.
when it comes in, and yeah. And Julie, your information will be on there, right?
Yeah.
All right. Awesome. Well, thank you everybody for coming.
Hi, thank you. Everyone
Thank
take care.
you.
Happy Friday.
Happy Friday. Take care.
Bye.
Bye.
Bye.